and it has been almost 50 years ago that I left Banaras Hindu University to join the University of California, Berkeley. And then I came to University of California, San Francisco, as you heard. And then I joined a company called Janantech, where I discovered some factors that is supposed to cure cancer and called tumor necrosis factor. And that is what took me to MD Anderson Cancer Center to test this tumor necrosis factor, also called TNF, to MD Anderson Cancer Center, and they tested this factor in cancer patients. It turned out that all the patients responded, but they got more sick than ever before. Which means, should it be called tumor necrosis factor or tumor promoting factor? So based on our cell culture studies, we had shown that it kills the cancer guy. And then based upon animal models, we had shown that it can beautifully kill all the cancers in animals. However, in humans, we are neither cell culture, we are neither animals, we are humans. And so therefore, when that factor was tested in humans, it turned out to be, it was actually causing cancer rather than inhibiting cancer. So it is at that time that we discovered TNF is a primary mediator of inflammation. Inflame. The word inflammation comes from a flame, a fire, and TNF is a primary mediator of inflammation. And this was the first factor to be discovered as a mediator of inflammation. So therefore, people made the antibodies against it, and they used antibody against TNF to block inflammation. And as of today, antibody against TNF have been approved by the FDA with a market over $50 billion a year. And no drug known to man has a bigger market. Just imagine. So we begin to, and those are all antibodies, which mean they have to be injected. So we begin to look at the inhibitor of TNF, and one of the first inhibitor that we discovered was turmeric. And as you know, I come from originally from Punjab, and my family migrated from what is today called Pakistan in 1947, and we were very, very, very poor. And as a result of which, if anybody got sick, we did not have enough money to go to the doctors. And one of the first thing that we used to use was turmeric, curcumin. And so from that time on, turmeric has been always on my mind, and we tested that turmeric as a TNF blocker, and we were the first one to report that turmeric can block TNF. And so since then, we have examined over 100 different compounds that come from the mother nature that can block TNF, and I'm going to share some of that with you. And then number two, what I'm going to tell you is also about Ayurveda. And Ayurveda, as you know, is a science that is the most ancient science known to man. And it has been around for thousands of years. And even as of today, Kerala, where I'm giving the talk, is the headquarters for Ayurveda. And I have met several Ayurveda doctors in Kerala. So we identified a lot of things from Ayurveda. And today I'm going to tell you a little bit what we identified from Ayurveda. And then I use the word nutraceutical. Everybody heard the word pharmaceutical, but not very many people have heard of nutraceutical. Even though these are the agents that are derived from nutrition, they have been around for thousands of years. So now that there is a word pharmaceutical that come from the pharmacy, and then nutraceutical that come from nutrition. So today, as you can see from the title of my talk, All what I'm going to tell you is inflammation plays a very important role in most chronic diseases known to man. I have yet to find a disease which is not connected with inflammation. So much so, even COVID, everything that COVID, what we are living through, that COVID does is through inflammation. So if you can block inflammation, you can block COVID altogether. It is that simple. And there have been now 80 papers published on COVID and curcumin and turmeric. 80 papers have been already published. So point of the matter is anything that can block inflammation will work for most chronic diseases, including COVID. So what is inflammation? And I'm sorry. I'm sorry. Is somebody want to say something? So anyway, so what is inflammation? How it does various chronic diseases and how to stop it is the title of my talk. Okay. And having said that, if we can now move on. So here, I'm not the only one saying this. Here is an article that appeared from Harvard, Tackling Inflammation to Fight Age-Related Ailments. Body-wide inflammation is tied to most chronic diseases, limiting people's health and longevity. Okay, and this is an article came on December 23rd, 2019 from Harvard. Again, I'm just sharing with you the headline. By the way, this presentation is available to anybody and everybody whosoever can make use of it. And here is another. JAMA is a Journal of American Medical Association. And the article appeared, Association of Chronic Inflammation, Insulin Resistance, and Severe Obesity with Mortality, Myocardial Infarction, Cancer, and Chronic Pulmonary Diseases. Again, communicating the same feeling that how inflammation is playing a role, what we are talking about. And here is another article from Harvard, that stop living with the danger of chronic inflammation. Can everybody see it? So again, to communicate with you that inflammation is playing a role, here is another one, drugs that quell inflammation reverses dementia. And dementia is again age-related disease. And this is an article coming from UC Berkeley, University of California, Berkeley. And that's where I got my Ph.D. from. And this article is appearing from there. And there is a book that my friend Sunil Pai has written called Inflammation Nation. And there's no country has more inflammation than America, the country that I live in. So people eat a lot of, 90% of the America eats out, and a lot of the food that they eat out lead to inflammation. And this is again forwarded by Andrew Vail and myself and Deepak Chopra. And one of the ways to fight inflammation is, here are some nuts that should be very familiar to you, and it is good for you. And again, this is a headline coming from Harvard. And exercise, again, that everybody knows that exercise is good for us, and that is another way to fight inflammation. And I think that some of you need to know that some of the drugs that have been discovered for cancer, here are two guys from India who were the first one to discover a drug against cancer. Again, to fight inflammation. And here is a Dr. Subbarao and Dr. Sagar. I put down the dates that they were around and what they discovered, again, to fight inflammation. So, and here are spices, and here you are living in the conference is in Kerala, and Kerala is the land of spices. And here are all the different spices. They fight inflammation, and as you can see from the headline, the foods with the highest aspirin. Aspirin is another anti-inflammatory agent, and spices are even more potent than aspirin to fight inflammation. And here is an organization called Ekal Vidyalaya. and that some of you may be familiar. And again, they are advertising turmeric and all the different fruits and vegetables to fight inflammation. And here is some food for thought I want to quickly share with you, that how complicated is the human disease. That human body is made up of 13 trillion cells, and each contains 24,000 different genes. And almost 98% of the human DNA thought to be junk is no longer junk. The human brain contains 100 billion neurons of at least 1,000 different type of varieties. These nerve cells make 100 trillion connections. Just like no two human beings are alike, no two cells are alike, and no two genes are alike. And almost 90% of the human body is made up of bacteria with over 1,000 species, and almost 1 million genes are coming what they call microbiome. And here we are worried about coronavirus. There are 50,000 viruses as we speak living in our body right now, regularly. So if so, how do we expect to have a cure to any disease by tangling a single gene, which is what most pharmaceutical companies do? So they tangle with a single gene, target single gene, when all chronic diseases mediated through dysregulation of multiple genes. So every disease known to man that is regulated by multiple genes. So here is a global, for example, cancer incidence, and I live in America, and what is shown here in the red is the highest incidence. No country has more cancer than America. No country has more diabetes than America. No country has more obesity than America. No country has more Alzheimer than America. And yet no country has spent more money to find the cure than America. And here is a country, India, where you are sitting. And India has the lowest incidence of cancer. And as India is becoming more and more advanced and becoming more and more Americanized, cancer is going up and up and up, and it is catching up with America. So in other words, the American lifestyle is not going to help you. And as I mentioned, 90% of the America eats out. So whatever is available on the freeway is what they are eating. So they do not rarely cook at home. So this just gives you about the cancer incidence. And here you can see that what the future holds. And as of 2002, there are 10 million cases of cancer and 7 million deaths. And as of 2020, 16 million cancer incidence and 10 million death. 2030, 20 million cancer incidence and 14 million death. In other words, cancer is going up and up and up. The death is going up and up. It is not going down. So as we are becoming more knowledgeable, more advanced, the cancer is going up and up also. So instead of going down, because we are becoming more intelligent, more educated, it is not helping us at all. So it is just a matter of what kind of lifestyle you lead. So what our working hypotheses have been over the years is dysregulated chronic inflammation caused by lifestyle factors mediate chronic diseases, including cancer. So everything is inflammation, and that inflammation caused by lifestyle factors. So here is a journal called Immunity, which is very prestigious journal. And the whole issue is about inflammation. And where the inflammation is coming from? It is coming from the cytokines. And we have worked on cytokine for the last 40 years. And as I mentioned, TNF is one of the mediator of inflammation. And now there are several different cytokines that have been identified that cause inflammation. And as you heard that I live in California, and in California, I live in San Diego. Mexico is only 10 miles from our house. You can imagine. So we are very close to Mexican border, and we get a lot of fires, and you can see on both sides there are fires burning. And these are the, that land gets very dry, And every year, some of the biggest disaster that happens in California is the fires. So we have written some reviews that you might be interested. The signaling pathways of the TNF superfamily, a double-edged sword. And this came in Nature Reviews, that when I use the word double-edged sword, means one edge of the sword is good because TNF is a very important part of the immune system, and other edge of the sword is bad. So fire is not bad. Fire is good. Inflammation is good if it is kept under control. It is only when it gets out of control, it can cause havoc. So without inflammation, without fire, you cannot cook. You cannot do anything. So you need the fire, but keep the fire under control. And most of that fire is coming from the immune system. We wrote another review called Historical Perspectives on the TNF and its superfamily, 25 years later, a golden journey. And when I use the word a golden journey, I mean turmeric, I mean curcumin, and that is the yellow color. And that's what we worked for 25 years to use curcumin or turmeric to control that fire. And that is what this means. And so this we were invited to write all this. So I won't have a time to go through all of them, but at least I'm trying to give you the perspectives that what we know about it and give you the headline. And here is another headline that appeared in a Time magazine, The Secret Killer. The secret surprising link between inflammation, heart attack, cancer, and Alzheimer, something that I mentioned earlier. And again, here you can see the fires within. And so depending upon where the fires are burning, it is giving you a different disease. So here is another review that we wrote, Inflammation, a double-edged sword for cancer and other age-related diseases. And as I mentioned, that one edge of the sword is good, other edge of the sword is bad. And that's what this is all about. So here you have a controlled fires. You have a kitchen, you can cook, you can do everything. You can turn on the stove. Here you have a living room, here you have a bedroom, and these are all good fires. And here same fire when it gets out of control, uncontrolled fire. Can everybody see it? So, and this is what it causes the havoc. And so where these fires are coming from, cigarette smoking causes fire. And solar radiation causes fire. Drinking alcohol causes fire. The meat, the obesity, these are all examples of fire. So these fires are bad fires. So SAD is fad. SAD means Standard American Diet. So what is the Standard American Diet is all shown here in the picture. And that is the fad. And this again came from the newspaper, that how they use this kind of food to push here in America. And that is very, very sad. So here is again sources of inflammation. So you have environmental pollutant, you have a food factor, you have a bacteria, you have all these viruses, you have a cigarette smoking, you have a stress. These days, a lot of people are under stress. So psychological stress, mechanical stress, and all this chemical stress, ultraviolet radiation, alcohol, all leading to inflammation. So cancer is a preventable disease that requires major change in lifestyle. So 30% of all cancers, they come from tobacco, another 35% from diet, 14 to 20% obesity, 18% infections, 7% environmental pollution and radiation, and only 5 to 10% is coming from the gene that we inherit. So people blame the genes every time, but genes have very little got to do with cancer, as you can see from this table. And this is again all published. And it was this guy, Rudolf Virchow, from Germany, and who was the first one to introduce inflammation. And he defined inflammation as a redness, swelling, heat, and pain. And this is a house, his house here, there in Würzburg, Germany. And he was the one to link inflammation with atherosclerosis, with rheumatoid arthritis, multiple sclerosis, cancer, asthma, Alzheimer, you name it. He was the first one way back then, more than 100 years ago. He also introduced the word for inflammation called ETs. What does ETs mean? Somebody says, oh, I have arthritis. It nothing means inflammation of the joints. That's it. Somebody say, I have a bronchitis, which means inflammation of the bronchus. So sinusitis, gastritis, and so all these ETs, that's all inflammation of different organs. So as of today, there are over 200 different ETs have been identified. 200 different diseases. Somebody says, I have pancreatitis, means inflammation of the pancreas. Stomatitis, inflammation of the stomach. So all these are different inflammation. So here is a inflammatory bowel disease, and it is, you can see from the prevalence, and it is leads to ulcerative colitis, which means inflammation of the colon. So in Japan, it is 7.9 per 100,000. India is 44.3 per 100,000, and US is 229 per 100,000. So again, US is taking the lead of ulcerative colitis. So here you can see all the different agents that I mentioned before: hepatitis, Helicobacter pylori, tobacco, high fat, radiation, and alcohol, and all that lead to inflammation, that lead to ETs, and this ETs lead to cancer. So our working hypothesis has been that there is a transcription factor, and this transcription factor called NF-kappa B. So this transcription factor is a major mediator of inflammation in most chronic diseases. And if you were to inhibit NF-kappa B, you can prevent or delay the onset of the chronic diseases. It is that simple. So I'm going to show you a lot of examples where we have shown just exactly that. So here are all the different genes that are regulated by NF-kappa B, and they are all linked with various diseases. And I'm going to go through all this, and you can see the list is very, very long. So we discovered this TNF. So TNF is the major activator of NF-kappa B that lead to IL-6, that lead to STAT3. And that what all leads to survival, chemo resistance, proliferation, angiogenesis, invasion, metastasis, bone loss, all of them have been linked. And this, and virtually every cancer, I cannot think of any cancer known to man that is not linked with NF-kappa B. So here I have put down all the cancers that have been linked to NF-kappa B. So NF-kappa B addiction and its role in cancer, one size does not fit all. So in other words, that NF-kappa B is the one that leads to cancer virtually in most diseases, and that's what we define. And these are all the different genes that we have linked to NF-kappa B. And again, you can look it up. And here is NF-kappa B involved. And most cancers start at the age of 20. So when a normal cell gets transformed, and then transformed cells starts survive, it leads to proliferation, invasion, angiogenesis, metastasis, and it takes 10 to 20 years. 10 to 20 years to go from here to there, and then another 10 years to go from here to there. So total 30 years process. So most cancers start at the age of 20, and they're manifested at the age of 40 to 50. So you can imagine 20 to 30 years of process of inflammation. And it is not only cancer. Here I mentioned all the other diseases where inflammation or NF-kappa B has been linked. Yet NF-kappa B is not very bad. It is a very important part of the immune system. It is needed for B cell development, proliferation, T cell development, so it is a part of the immune system. And even a lot of coronavirus things that it does through NF-kappa B. So cigarette smoking, here we are the first one to show it activates NF-kappa B and induces COX-2. And here is just different stages of lung cancer that we indicated, and what gray color is the amount of NF-kappa B that is in there. So we showed way back there. And here even obesity, that obesity is very common, 14% of the obesity in male and 20% of the female. And here that leads to all the different cancers as indicated over there. Obesity leading to cancer. So NF-kappa B is the enemy within us. NF-kappa B can a friend. It remains in the immune system. Moment it gets out, it can lead to cancer. NF-kappa B in cancer is a matter of life and death. So we have written a lot of these review articles, and you can look it up to get yourself better idea. So here basically you have a stress which leads to NF-kappa B, lead to inflammation, lead to cancer. Again, show you very, very simple way of proceeding. So neutralizing tumor-promoting chronic inflammation, a magic bullet. And this is my colleague Lisa Cousin, and she comes from San Francisco. She wrote an article in Science. So how to block inflammation? You have a steroid, you have an NSAID, you have a Celebrex, metformin, statin, and they can all block inflammation. But today I'm going to talk about natural products and traditional medicine. And these are the agents that we have shown in our own laboratory. They block NF-kappa B and they block inflammation. And you can see that they are spicy, they are Ayurvedic medicine, they are fruits and vegetables, they are traditional Chinese medicine, and there are various others. And these are all good things. Everybody should eat it because they all control inflammation. And that's what I call anti-inflammatory lifestyle. And here are the active compounds that we have identified from them to show that it blocks inflammation. And you can see again, the list is very long. And whatever we are saying is nothing new because it was Hippocrates proclaimed 25 centuries ago. Let food be thy medicine and medicine be thy food. And that's what we are talking about, using food as medicine. So inflammation, lifestyle, and chronic disease is the silent link. We have a whole book that is written. If anybody is interested, can look it up. And so this book is available. And here are what we call farmers market, and everything should be very familiar to you. We have identified all these agents that can block inflammation. And here is more vegetables. And here are pulses, there are nuts, there are cereal. They all block inflammation. And these are all the different kind of fruits that we have put together that can block inflammation. So you can imagine what we call farmers market. And here are all the different spices. And nobody knows more about spices than you guys do. That, as you know, it was Vasco da Gama and Christopher Columbus that who were looking for spices, and they knew spices are connected with India, and that's why they were looking for India. And one guy, Christopher Columbus, discovered America, but he thought it was India. So now the people who are living there are called American Indians. And then whereas Vasco da Gama that discovered India, and he's the one we organized our conference in Goa, and that's where he landed, and while he was looking for spices. And here is in San Diego, where I live, there was another guy, Jose Cabarillo, who also came from Spain around the same time, 1450. And he was also looking for spices. And he's the one who discovered San Diego, and he's the one who discovered California. But he was looking for India. So, and his house is just a couple of miles down from our house. So apparently, here are all resveratrol is one of the compounds that we discovered that can block NF-kappa B, and these are the different sources of resveratrol. And here are again several reviews that we have written. Again, you can look it up. I don't want to kind of go through it. And here is another compound called indole 3-carbinol, and we discovered that can block NF-kappa B. And here are all the different sources of indole 3-carbinol, and all this should look very familiar to you. And here is a tocotrienol, is the vitamin E of the 21st century, and the building that in which where I got my Ph.D. in Berkeley is where this vitamin E was first discovered. And again, there's a tocopherol and there's a tocotrienol, and the difference between the two is there's a 3 double bond that are present in tocotrienol, which are not there in tocopherol. And here you can see all the structures and so forth. And this is where tocotrienols come from. And is a palm, rice, barley, oat, wheat. All this should look very familiar to you, and that's where tocotrienol come from. And here are a lot of other sources of tocotrienol that I indicated and how much it is in there and all of that. Again, we have published a lot of reviews on this. And here is tocotrienol. We are trying to show that it blocks NF-kappa B very easily. Everything, whole pathway is laid out. And tocotrienol treatment for patients. So if it blocks NF-kappa B, does it cure cancer? And here we looked at the pancreatic cancer, and we showed that again it works quite well, and we published it. And here is Ayurveda. So Ayurveda has been again a science in India that existed for a long, long time. I'm sorry. So this is a science of long life, and this is a medicine, and that has been there. And again, we have identified a lot of things from Ayurveda that can suppress inflammation and cancer. And we have several reviews written, and you can look it up. And here is a Google. This is a Google that was there even before the other Google that you know came along. And this is one of the compound from Google is Google sterone that blocks NF-kappa B. Here is Googling the Google for prevention of chronic diseases, and we have written a review. And this is the Google sterone is the active compound that blocks NF-kappa B. Here is a frankincense, Boswellia serrata, and they call Salai Google, and we identify the compound that blocks NF-kappa B. And here is a vithanolide called ashwagandha. Ashwa means horse, gandha means smell. It smells like a horse. And so this is Withania somnifera, and that also blocks NF-kappa B. Here is you have a small pepper, and here is a long pepper, and this is a long pepper. Again, we showed that blocks NF-kappa B called Piper longumine. And again, you can look it up. And here is a neem. And neem is a tree that is very native to India. Virtually every place in India has a neem. And it is called Azadi Raktika Indica. Azadi means freedom. Drakt means tree. Tree that gives you freedom from all diseases is called Azadi Raktika Indica. And here is a compound called nimbolite that we identified from neem that can block NF-kappa B. And here is the paper that has been published way back then. And here is another one that blocks cancer. And here is now the spices. That how spices work and chronic diseases, inflammation and spices, how are they linked? And again, this is some of you may know Ajay Kunu Makara, and he has been the driver for this. And here are all the different spices, what I call add spice to your life. And here is a Vasco da Gama, and looking for spices, how he moved, from different places here within India, from through Africa, and looking for spices in 1498. And these are the spices what he was looking for. We have a whole book called Healing Spices. It has been already translated into Spanish and Italian and German and all different languages. And we talk about all spice by spice. We have another one called Immunonutrition, Interaction of Diet, Genetics, and Inflammation. This is with David Heber. He's a professor here in UCLA. We have written a book. Another one, Molecular Targets and Therapeutic Uses of Spices. Again, this is all out there. Any of you can look it up. And they call Add Spice to Your Life, Curry in a Hurry, Spice It Up, Spice Queen, Spice Goddess. These are the kind of terminology that I use very often here in America. And a lot of American moments, they are named after spices. So for example, anise, ginger, rosemary, mace, pepper, basil, tulsi, sage, jasmine, angelica, curry, chili, tamarind. These are all the names of the American women, and they are named after spices. And dietary nutraceutical as the backbone for bone health. This is another one that a lot of bones can be fixed just by using that dietary nutraceutical. And this is a review that we did. Healing with spices, and these are the different spices. Again, just I'm trying to give you, here are more spices, and here is just to focus on one spice, and that is turmeric. And this is turmeric, and what gives the yellow color is called curcumin. And this is where we have linked the different targets and how curcumin works. Molecular targets of nutraceutical derived from dietary spices. We have written a whole review. And here is a curcumin, capsaicin, diacetyl, anethol, eugenol, ursolic acid. These are all active compounds that have been identified from spices. And here is a red chili. We showed it blocks NF-kappa B. It blocks STAT3, which is another pathway that linked to inflammation. And here is a ginger and gingerol and zarambone. We showed it blocks NF-kappa B. And here is a, if it blocks NF-kappa B, does it fixes the bones? And here we shown that yes, it does fix the bones. And here is a black cumin. And again, we showed it blocks NF-kappa B. Here is a fenugreek, and again the active compound is diacetyl, which showed it blocks. Here is a fennel, again active compound is anethol, it blocks NF-kappa B. Here is a black pepper, again it blocks NF-kappa B. Here is a cardamom, here it blocks NF-kappa B. Here is again cardamom, and here is turmeric, the golden spice from traditional medicine to modern medicine. And curcumin, getting back to our root, this is the active compound, and this is what this curcumin and ginger looks like. And here is we have a whole review that appeared in Trends in Pharmacological Sciences, the pharmacology of curcumin. Here we are in cover on of that magazine, and in South India, no ritual is complete without turmeric, and they put this on the cover of this magazine. And here is virtually every country in the world have a different names for curcumin. And here is in Sanskrit. There are 50 different names of curcumin in Sanskrit that has been written, and I put all of them over there. And each one of the name tells you the properties of turmeric. So pharmacological basis for the role of curcumin for chronic diseases, age-old spice with modern targets. And there is a turnout there are over 100 different kinds of turmeric. And here are I put all of them. And the one we know the most is Curcuma longa. And very little is known about other kind of turmeric. And this is the guy, 1842 was the Vogel was the first one to isolate curcumin and determine the structure. So I will put the first paper ever to be published on curcumin was in Nature, 1949. You can imagine. And here, just to show you the structure, turmeric, before the pH meter came along, turmeric was used as a pH indicator. Because if you put it under alkaline condition, it will turn red. If you put under acidic condition, it will turn black. So you can tell the pH of a solution by looking at turmeric. And Johnson & Johnson has made a Band-Aid where if you get hurt, you can apply this Band-Aid to cure any kind of wound, you know. So, and the first paper ever to be published was in Nature. As I mentioned, it is as an antibacterial agent. So it kills the viruses, it kills the bacteria, it kills the fungus, it kills the termites, it kills the cancer. The list goes on and on and on. Okay. And so this was the first paper, and here it blocks the inflammation, and they compared with hydrocortisone and turned out it is better than even hydrocortisone. This was a paper published from India in 1982, you can imagine. And here we were the first one to show that it blocks NF-kappa B. And this is our paper published in 1995. And here are all the genes that are inhibited. And here is all the different cancers curcumin can work. And here are all the different targets. And here is even a more target that actually physically binds to and interacts and blocks it. And it also blocks TNF. And again, my time is running out, and here are all the TNF related diseases and how they are cured. And so all those drugs that they have come up with has a black label warning, and curcumin can do just that. It can block TNF and block all the various diseases. And again, as you know, that everything works in the test tube, everything works on animal, but very few things work in human. And here is a woman, her name is Usha Rani, and she's from Hyderabad. She was the first one to show that curcumin blocks TNF in the people. And she looked at 21 patients, placebo control. You can see no effect on TNF. Here she used curcumin, 150 milligrams twice a day, and 23 patients, you can see pre versus post, it inhibited TNF. So it worked very well even to block TNF in humans straight. Now there are over 300 clinical trials. Here I put some of them, and you can look it up. There are a lot of clinical trials have been done. This is the first clinical trial that was ever published by Albert Oppenheimer, and way back in 37. Curcumin bioavailability, a lot of people think it is a problem, and we have published a lot on this one, and I don't want to kind of go through it. And here, when curcumin is given, it ends up in blood, thyroid, heart, lung, liver, spleen, muscle, brain, everywhere it has been determined. And I happen to be giving a talk in Bulgaria, and the guy came to me and he uses curcumin for all his patients. And here they showed me some of the wounds that when he applied curcumin, that how they got cured. And curcumin for psoriasis, again, that there is a woman here in Los Angeles called Madeline Hang, and she uses curcumin topically to apply on the people with psoriasis. And you can see, so she calls it psoria gold. And here is a uveitis, another disease, and you can see itis means inflammation. And again, 80% of the patients responded. And so it is synergistic with resveratrol, green tea, quercetin, piperine, genistein, and you name it. And here is a guy from NIH who had put together countries that eat turmeric, incidence of cancer in male versus female, and countries that do not eat turmeric, incidence of cancer in male versus female. So in other words, turmeric is helping them a lot in these countries. And this is a National Cancer Institute in the US who published that. And here is a cancer incidence, cancer by cancer in the US versus India, and cases and death. And you can see for USF side by side, and it is work very well. And they wrote an article, Spicy Approach to Cancer Treatment, Curry Compound Fight Cancer in the Clinic. And you can look it up. Scientific American calls us spice sealers. And apparently I happen to be giving a talk in Turkey. And I was supposed to be in Turkey last year because of coronavirus. Everything got canceled. Here I'm standing over here in front of a spice shop, and my wife Uma, she's taking my picture. And on the top here, you see it says Bharat. You know, and so in Turkish language, Bharat means spices. So no wonder I'm working on spices all these years, because Turkish people call Bharat as spice, and they always invite me to give a talk on spices. So haldi is healthy. And here is another one that we did. They opened up now restaurants here. This is in New York, Manhattan area. They opened up a restaurant called Haldi, the Indian cuisine. Here is in Palo Alto, Silicon Valley, where Apple, Google, and everything is. They opened up a restaurant called Turmeric, the golden spice. And you can see everything is yellow. And here they are also selling turmeric cookies and turmeric latte. And you can see that what it looks like. And we have some other books and all that. I don't want to go through it. And here turmeric is now used for all these different things. And again, it is no surprise to you because a lot of it is just coming from India. And we have organized, I mentioned with the woman, and woman is the driver of all this, the first conference in Cochin, Kerala, that we had organized from September 9, 11, 2016. And he was the driver for this conference. And again, focusing on turmeric and all the other different spices. And here I just want to thank all the people who have worked with me over the years.